Welcome to Understanding Exceptional. I'm Dr. John, and this is 5 Minutes Unfiltered, where I discuss a topic for 5 minutes. Today's topic is what's really causing autism spectrum disorder. Here we go. So, in prior videos, we discussed the fact that autism spectrum disorder is a set of words that represents a cluster or a group of behaviors, and those behaviors start in the brain. Can't have behaviors without a brain. And we talked about the idea that it really is the regulatory systems in the brain that are causing the behaviors that we've now associated with autism spectrum disorder. So knowing that, if we want the medical or neurological or psychiatric community to have access to what's really causing autism spectrum disorder or the behaviors associated with it, we have to solely focus on the sources of behavior, the brain, not on the behaviors themselves. So now let's look at what are the regulatory systems that might be involved. Regulation of the brain starts with the all-powerful cerebellum. And I am telling anyone that will listen that we are going to find a lot of answers in the cerebellum as it relates to those behaviors. And if our goal is to identify why they're occurring to begin with so that we can create cures or we can stop the disorder, we need to focus on those systems that are associated with the behaviors. And that cerebellum undoubtedly is associated with it. From a practical standpoint, in my private practice, obviously anecdotally, haven't run any studies. When I have a family that comes in and they have a child who has a developmental condition or an external event that has changed the functioning or the development of their cerebellum, I oftentimes see behaviors that are very much consistent with autism spectrum disorder. And so we know that there is an overlap between how the cerebellum is developing and how it's functioning and the behaviors that we may see. The cerebellum is the regulator of everything the brain does, and it's the starting point there. It regulates movement, and it refines movement. It regulates and refines thought. Now, there'll be some controversy. There might be some people in the medical field that respond to this and say the cerebellum is movement. And that's simply because the only thing they can see with their eyes is movement. They cannot see your thoughts. But the cerebellum absolutely controls the regulation of and the sequencing of the thinking. Thinking is simply internal movement, and that will be a different conversation. But inflammation of the cerebellum or atrophy of the cerebellum or genetic conditions that change how the cerebellum develops and functions, this is where we need to start looking if we're really going to figure out what is causing these behaviors that we've assigned these words. And we also then need to look at the remaining regulatory structures. We have the cerebellum, we have the basal ganglia, we have the prefrontal area. But this is the network that regulates those sensory systems. And knowing that autism spectrum disorder, the diagnosis, is fundamentally dysregulation of various aspects of those sensory systems, we need to start investigating those systems themselves, not worrying about as much what behavior should or shouldn't be in the diagnosis. We need to look at what brain systems are involved. What do those brain systems look like? Is there consistencies in things that cause changes to those brain systems that result in the behaviors that result in a diagnosis? Because the brain is always the source. The behaviors are always the symptom of whatever's happening in the brain, and the behaviors represent our internal experiences as well. So the symptoms are the behaviors, the source is always the brain. And if we want to figure out the source of the behaviors, which is what all autism spectrum disorder is, a set of behaviors, we have to look at the sources. So additional studies into subcortical areas, cerebellum, basal ganglia, prefrontal area, any genetic condition, any vaccination, any medication that may cause inflammation or degradation of those systems. Once we understand the systems themselves, now we can look at, are these things causing changes to those systems? And if we use that paradigm of thought, and I know this particular 5 Minutes Unfiltered is a little bit deep and academic at some level. I know you guys all understand it. But if we really focus on the sources of the behaviors and not worry so much about, well, we have somebody diagnosed with these 3 words now, what is it in their history that we can relate to it? We just need to look at the brain, and we need to get to the point with AI and through medicine where we're really looking at the myelination patterns, the growth and developmental patterns of regulatory systems, and really drilling down on what regulatory patterns do we see when we see these behaviors that result in this diagnosis. Once we figure that out, we can figure out what's changing or what's causing those changes, and now we can eliminate or cure autism spectrum disorder. I'm certain that this is controversial to many, and I think controversy promotes discussion, and I want you involved in the conversation, agree or disagree. Get involved in the conversation. Our conversation creates understanding. Our understanding creates our empowerment. Looking forward to seeing you on the next video.